All right, the time being 9 a.m. on Wednesday, November 17th, 2021. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call roll for attendance.
Silva,
Here.
Lewis,
Lewis here.
Shepro, Strathman,
Strathman here.
Tepe,
Tepe here.
Wallace, Sanchez.
Here.
You have a quorum.
All right, can someone please ask for unanimous consent to approve the minutes of October 20th, 2021?
I so do.
Any objection? Minutes are approved. Finance and budget. Are there any questions or comments on this month's budget and finance report from the Health Committee or from the Public Health Department? Hearing and seeing none, we'll move on to public comments on agenda items, and we'll also take non-agenda items. Anyone is here to speak? Don't see anything. So we will go to the Executive Director's update. Ms. Foster.
All right, excellent. So we will be pulling up the presentation, which Ms. Uche Onwuta will be doing for us this morning. And I know it says update COVID-19, but we have just a couple of other little things added. Public health related.
Good morning. Can you hear me?
Yes.
Okay, great. Good morning. My name is Uche Onwuta, and I'm the Director of Health Protection, King County Health Department. I'm starting off with the COVID-19 update. So as of yesterday, our total population vaccinated was 346,113. Sorry, 318,927. 346,000 have received at least one dose. So we have almost very close to 60% fully vaccinated. For population 12 plus, with at least one dose is 76.9%, fully vaccinated 70.9%. Is this thing about 0.9 that's on all the numbers today? Population 18 plus with at least one dose, 78.7%, and about 73% fully vaccinated. And for our population 65 plus, 94% with at least one dose and 86% fully vaccinated. IDPH reports 57.8% fully vaccinated for King County. As I've mentioned in previous presentations, the IDPH and the CDC numbers are different. You will notice this time that our population fully vaccinated seemed to have been less than what we had the last time. Sometime within the last month, CDC and IDPH kind of were able to merge their data. So our numbers, the CDC numbers, are a little bit closer to the IDPH numbers. It seemed like our at least one dose went up, but the fully vaccinated went down. So I'm more comfortable with the data we have right now, because it always bothered me that we had way more people with at least one dose. And I'm always wondering, like, why couldn't they finish? You know, this is more believable because there could be reasons why others have not finished, or maybe they just had their first dose and waiting for their second dose. Okay. Most children and all teens can get COVID-19 vaccination. I wanted to put this out here. The KaneVax Hub is now vaccinating people 5 years and older. So we had our first pediatric clinic last Wednesday. So the 5 to 11-year-olds are now being vaccinated. They can only get Pfizer, just as the 12 to 17-year-olds. So children 5 to 17 can be vaccinated with only the Pfizer BioNTech vaccine. The population 18 and older can get any of the 3 vaccines, Pfizer, Moderna, and Janssen. So King County is still in high transmission. The last 7 days, our case rate was 139.74 per 100,000 with a case positivity rate of 3.55%. We've had at least 70,000 cases so far with 896 total deaths. Hospitalization in the last 7 days was 61. So the COVID is not going away by any stretch of the imagination. In fact, we seem to have started trending up. Okay, this is our weekly case rate. Oh, great. Looking at the weekly case rate by race ethnicity, you can see that the Hispanics have a much higher case rate at 603, and African Americans at 421, white 257, American Indian, Alaskan Native 109. This was as of November 6th, so there's still a racial disparity with the cases. And there's also age disparity. Right now, most of our cases are under 20 years old with case rate of 232 per 100,000. Looking at just the children, you can see that the orange one is for children 5 to 11 years old. So most of our new cases are among the age of the children who are eligible for vaccination. So I hope this would clear it out, encourage parents that, vaccination is key here to keep our children in school. Once they're fully vaccinated, they no longer need to quarantine, when they're exposed to a case. So right now we have 7 school outbreaks around the county. These outbreaks were within the last week. So we're really seeing an increase in cases and outbreaks. So this is a SARS-CoV variant. Right now, most of for those cases that were sequenced, 99.4%, there's only 1 case of B11318, which is kind of new in the area. I had to research it, and this is causing an outbreak in Mauritius. We only had 1 case. Otherwise, the rest of it is Delta, as you can see. Of note is we're not seeing the Delta Plus variant here. So as I mentioned, if you look here, you can see that we're trending up right now with our cases. So our call center has been hard at work with the contact tracing and case investigations. So I stole this slide from the IDPH presentation yesterday. Unvaccinated people with a previous infection were 5 times more likely to have a positive COVID test compared to vaccinated people. this is a good reason for us to get vaccinated.
That was a previous COVID infection or just any infection?
Previous COVID infection, yes.
Shepro, sorry.
So as much as we've been all COVID this year, October started our flu season. Just wanted to plug in here, getting vaccinated against the flu is also very important. In 2019, we had 82 deaths due to pneumonia and flu.
Excuse me, is there any reason why the 2020 data isn't in there?
2020 data,
Yeah.
it takes a while before it hasn't been verified yet. It has to go through. We actually closed out reporting in, I believe, in June. So the state tallies the numbers and then sends to CDC before they are verified and then posted.
I had just heard that numbers of flu last year were just way down because.
Yes, that's why I didn't put it in here. 2020, the numbers were very low because the preventive measures for COVID-19 are just about the same for flu. So the masking worked really well, social distancing worked really well for flu. So.
That was Mr. Tepe asking questions for those on YouTube and for the record.
So as we're getting ready for Thanksgiving, just wanted to plug in, since environmental health is one of my areas, to prevent foodborne illness, wash your hands, safely thaw your turkey, make sure that the turkey is cooked to at least 165 degrees and avoid raw pet food.
Again, that's Kane County numbers, the 356.
Don't do that.
Sorry?
Mr. Shepro, you had a question?
Yeah, so the 356 are Kane County.
No, those are not King County numbers. This is MMWR post that I just stole.
Those nationwide.
Oh, okay.
Mhm.
Thinking I was a lot of locally unsafe turkeys, but okay.
Happy Thanksgiving, everyone. I'm grateful to be alive and healthy. I think that's my last.
All right, thank you for that, Uche. Are there any questions or comments? Mr. Shepro?
Of course.
Always.
The couple questions. When we say we're in high transmission, is that the definition, is that from the CDC or the state? Where is that scale from?
The CDC, that's a national designation for high transmission.
And how long has that been in effect?
How long has the designation been for King County?
No, but I mean, when did somebody decide to start using that scale to analyze the incidence of COVID? In other words, March of 2020, or did it develop?
Mhm. That's a good question. I don't know that designation because everybody was in high transmission as of.
I mean, somebody had to decide that some number represented high transmission as opposed to medium transmission.
Right.
And I wondered what went into that. And I guess sort of as a follow-up, for in past years, for say seasonal flu,
Mhm.
and as we learned, we don't have the 2020 number. So in 2019,
Mhm.
how would that infection rate have compared to the 137 per 100,000 that we have now?
So the 137 per 100,000 is the COVID rate. For flu, we don't have nearly as many for flu,
So
And-
it's less than 137 per 100,000.
possibly. And, with flu, most people don't go to the doctor when they have the flu. and you have to test everyone who has the flu to make sure that they have influenza A or B, and not necessarily common cold. So there's a lot that goes with it. We for flu surveillance, we concentrate on hospitalizations, ICU hospitalizations, and outbreaks in long-term care facilities. And we also have outbreaks in schools. We've had a number in the past, closed down some schools because of an outbreak. Well, the health department did not close down the schools, but the schools ended up having to close down because of an outbreak.
And one more, the governor, I think recently said something to the effect that he didn't feel the numbers were low enough to, I guess, reduce or eliminate the state of emergency.
Right.
And I guess I'm wondering, do we know what that number is, or are we going to know it when we see it?
Yes, we do know what the number is. That's why the designation for high transmission is important, because as the numbers were going down for COVID in the summer, CDC had to come up with something to, to let people know at this point it's safe to not wear. If you remember in the summer when we were not wearing masks because our numbers had come down. So if the designation is low or medium transmission, then we reduce the preventive measures. But for places of substantial and high transmission, that's when you implement masking, and all those other measures that we have in place, indoor masking. So if we can do what we can to reduce the numbers, and that's why the governor couldn't remove the executive order, because we're still in high transmission.
Thank you.
Any other questions or comments?
I have a question. Bates,
Ms. Lewis,
please.
go ahead. Oh, is this Bates? Bates, go ahead.
Ma'am, is there something that you must be so frustrated by this, and I know how hard you're working. Is there something that you want people to do that they're not doing right now that you think would bring down the transmission?
I think the most effective measure to bring down the transmission rate right now is vaccination. If we can get our vaccination rates higher, it would definitely help us to not keep going back to outbreak mode every single time. Because if you have more people getting vaccinated, removing them from the pool of those who could possibly come down with the disease, then we can stem the spread of the disease. Of course, we have breakthrough cases. There are not nearly as many on vaccinated people compared to those who are not vaccinated. So the best preventive measure is vaccination.
Okay, what about masking?
Absolutely, masking is very critical. The benefit with masking is that, if you're wearing a mask and the person next to you has COVID, it's not 100% that you will not get COVID. So that's why even when you're fully masked, you're aware of those who are in your surrounding to make sure that everybody is masked up, to prevent further spread.
What are the risks to fully vaccinated people right now?
What are the risks for masking?
No, for fully vaccinated people. What are the risks for if you're fully vaccinated?
The risk is much lower. We do have a couple of breakthrough cases. They're not nearly as many as for those who are not vaccinated. So the risk is lower for those who are vaccinated. And that's the reason why we're confident enough to say that if you're vaccinated, you don't have to quarantine, but you watch for symptoms in case you come down with symptoms.
Okay, thank you very much.
You're welcome.
Mr. Chair Gums, I have a quick question.
Gums, go ahead.
Thank you so much, Mr. Chair. Quick question. I logged in a couple minutes late, so I apologize if it was already answered, but is 60505 still our least vaccinated area?
Yes. Unfortunately, yes.
Okay, thank you so much.
Mhm.
Lewis with a question.
Go ahead, Lewis.
What about the booster? And maybe you mentioned it. Can anybody get the booster now too?
So I'll let Ms. Barrett answer that.
Sure. This is Laura Barrett from the Health Department. The booster is available in all three of them, both the Pfizer, Moderna, and Janssen's. Of course, Janssen's and Moderna, you have to be 18 years of age and older, and also 18 years of age older for the Pfizer. The booster is not available for the 12 to 11-year-olds yet. Also, the current guidance that we have from CDC and IDPH for the boosters is anyone that has received a Janssen's can receive their booster 2 months after they had their dose. But for the Pfizer and the Moderna, there is some, they would receive that booster 6 months after their last dose. And it's really important that they do not come even a day earlier. We have been advised that it has to be 6 months or longer. So with that, Pfizer and Moderna also has some limitations of who is eligible for that booster. Both of them are for individuals that are 65 years of older. If they're 18 years and older in a long-term care setting, if they're age 50 to 64 with underlying medical conditions, and then in addition, if they're age, sorry, that was the immune compromised. Sorry, I got the wrong line here. If they're 18 to 49 years of older with underlying medical conditions, and if they're 18 to 64 years older with exposure such as in an occupational setting or an institutional setting. So there's, it's important that everyone looks at the guidance on that. We ask that individuals come to at least to the CaneVax Hub, they just attest that they follow that guidance and meet that guidelines with it for when they come in to get their booster with it.
Okay, and are we encouraging people in those groups to do that?
Absolutely. We've sent out
Okay.
notification. As you recall, way back in the beginning days of January, February, and March, we had the sections of 1A eligibility, the 1B eligibility. There was notices sent out to all of those groups that came in and received their vaccines when the vaccinations were limited at that time, to remind them to go out and have their employees get completed and have them receive their boosters. And that notification has been sent on out both electronically and then also in advertising publicity statements that we put on out with it too.
Okay, great. Thank you.
Mr. Shepro.
What is the reason now for the limitation on the availability? Is it supply or staff or?
Not supply and not staff necessarily. It's the current guidance when the approval for the boosters went through, if you recall, through the FDA, the ACIP, and then finally to the CDC, and then CDC director signed off on it. The research at that time was showing these are the ones that are most vulnerable to be needing the boosters. And that's why the restrictions were put into place, because it came off of that whole process that they do for the review of the research with the boosters.
Does that suggest that there is still some doubt as to the safety or efficacy of the vaccine, so that they're limiting it to people that fall into these higher risk categories?
I do not believe that. I've not heard that or seen that. I think the vaccines are very much effective, as we can see from the data that Uche just went through with what we presented. I don't think it's an efficacy situation. I think it's more, these areas are going to be high transmission areas, and those are areas that would be having higher incidence, such as you're working in a congregate setting, somebody in that area gets COVID, it's easily spread within, which we saw very early in the pandemic. Those areas were very highly hit, such as our jails, our long-term care facilities, our assisted living facilities, and the hospitals. And then the staff that's taking care of those individuals in those areas are also at an increased exposure than it is for the normal public that might be going out and about doing their
Yes,
business.
that's why I'm puzzled as to why there would be a limitation. Since apparently everything about it is good and reduces your risk. And I would think that if it reduces the risk in high-risk people, it presumably would also reduce the risk in non-high-risk people. So that's why I guess I'm puzzled by that policy.
Bates,
May I-
please.
Yeah,
Bates.
Hold on, Ms. Bates.
Okay.
yeah. I just wanted to add to what Laura just said about that. So at the beginning, when they started this, it's about, priority, what is most important, like Laura said, and the studies that they had done at the time. So now Pfizer is going back to FDA and asking for everyone that's 18 and older to get the booster, based on the additional studies that they've done, because of the short time, for the research into some of these things, as new information is coming up, they're going back and asking for more approval. So I think that's.
But I think this is Michael Isaacson from the Health Department. I think directly to your point, Dr. Ezike, the director of the Illinois Department of Public Health, stated, and I think as Director Onwuta just said, Kane County is an area of high transmission. Illinois is an area of high transmission. When we look at this criteria, including the workplaces, these are examples. So each person has to self-evaluate what their risk is. So right now, if somebody is over 18, they're living in a community with high transmission. So if they're out in the community, they're potentially at higher risk. As you said, the booster will protect people. We know that the vaccine efficacy does start to wane after 6 months or so. So people need to make that determination for themselves, but getting a booster shot is going to provide more protection.
And the medical conditions are pretty
I mean,
vast.
everybody in the county currently has that.
I'm on stack, please.
Yeah, people
Ms.
will
Bates.
self-attest when they come in if they're at high risk and meet the categories.
And just for a point of reference, underlying medical conditions is a very broad
Yeah.
range. Anyone with a BMI over 25 would qualify for a booster shot. So
That's most
anyone,
people.
that's over 2/3 of our population right there. With it, just anyone that's overweight or obese would automatically qualify for that. So it's a very broad brush that they've availability for that.
Yeah, I had no trouble qualifying.
Thank you. Ms. Bates.
Is part of the delay in opening it up to everybody, just capacity for getting the shots into arms? Are we trying to prioritize just based on capacity?
Not that I've experienced. Everyone that's been interested in getting that booster has been able to get that usually within days after they're eligible for it. So as long as they meet the criteria, the 2 months for the Janssen's and 6 months for the Pfizer, Moderna, they should be able to get that vaccine. And there's plenty of places that you can just walk into. Most of our pharmacies will do so. Many of the doctor's offices are providing it, along with the Kane Vax Hub.
Well, but like Mr. Shepro said, we still got these eligibility requirements. Will it open up soon to everybody?
We're waiting for that guidance from the CDC and IDPH.
Okay, thank you.
So as that research comes out, I anticipate that we'll hear further information as this continues to evolve, as it has been evolving.
Okay, thanks.
I would suggest, Ms. Bates, that anybody that wants the booster shot, go to KaneVax Hub and go through the registration, because chances are that the person might qualify. Like
Okay.
Laura said, the underlying condition is almost everyone is eligible based on that.
Okay.
And again, just to emphasize, the jobs that are listed as the criteria are listed as examples. So it's not an all-encompassing list.
Okay,
So
thank
people
you.
should really self-evaluate their own level of risk.
And when you do, this is Laura from the Health Department again, and then just when you do come to the KVAC sub, we do not ask for any criteria. We do not ask for any proof that you meet that criteria. When you sign the consent, you're consenting that you meet that criteria. So we will provide that vaccine to you. The big concern is just to make sure it's after 6 months after you had your last shot or 2 months after the Janssen. So there's no proof that you have to show.
Is there something wrong with getting the shot before 6 months, like health-wise?
We've been directed by IDPH specifically not to give it prior to that 6 months for the Pfizer, Moderna, and 2 months for the Janssen's. That has been the request from them to make sure we follow those dates exactly.
Thank you.
All right, any other questions or comments on COVID update? I just did want to mention in that the pie graph that you showed us, Uche, with all the strains that we're seeing. It's very notable that it's almost all Delta. We don't see any of the older strains that were more prevalent on that pie chart even a few months ago.
Exactly.
So just thinking ahead in the future, hopefully we'll start seeing nothing come in there. It'll be flu. Flu and maybe a little Delta. That'll be nice. So, all right. Is there anything else that you have? I know, Kathy, you mentioned you might have something else in this section outside of the
Oh,
COVID
no, I
report.
just wanted to make sure because Uche was talking about safe food handling and
Oh, yeah,
and
okay, I
things like
gotcha.
that. So just wanted to make sure.
All right.
The holidays coming up.
Excellent.
Mr. Chairman, the fire departments report that one of the biggest responses on Thanksgiving is people trying to deep fry their turkeys and starting a fire.
Not saying I've seen it happen, but I've heard of it happening.
Yeah.
So, all right. Moving on then, if you guys have nothing else for our monthly update, we'll go to animal control. Brett, good morning. Oh, Brett, are you there? We can come back in a moment.
Can you hear me?
Oh, there he is.
All
Hey,
right,
Brett, how you doing?
perfect. So, hello, everyone. Our expenses were greater than our revenue, which was expected this last month. That's actually due to the way Chameleon has their billing and us catching up on a lot of our reports through COVID time. So that was completely expected. I just wanted to make sure I explained that to everybody. So that's also probably going to happen next month, but this is part of the reason we're so cautious the rest of the year to make sure that our revenue exceeds our expenses as it is, and the money's there. I just want to make sure everybody is alerted to that. We're very lucky. Senator Villa's office over here out of Batavia sent 2 of her employees last week to come visit us and do a tour of our facility. We were very lucky. We thanked her office for that. It was a pleasure to speak with her and to speak about some of the legislation going on in Illinois regarding animals. So it was a wonderful opportunity to make contact with her offer. The only other thing we have is we're still having trouble hiring some of our positions due to our low wages. Next month, I'm hoping to put forward some stuff of research we've done to hopefully put our salaries more in line with what everybody else is doing so that we can be a little bit more competitive here in King County and actually start getting some employees. Because if I have one warden go down right now, we're in a lot of trouble. Those 2 have worked nonstop every other week for the last year, and I cannot thank them enough for the amazing work that they've done. That's all I have this month for you.
And thank you, Brett, to you and your staff for doing what you do. Are there any questions or comments for animal control this month? All right, thanks for being here, Brett.
Thank you.
Have nothing under old business. Unanimous consent for reports to be placed on file.
Request unanimous consent to place reports on file.
Any objections? Reports are on file. No need for executive session. I have no new business or public comments. Is there anything members of the committee want to bring forward at this time before we adjourn? Hearing and seeing none, I'll ask for a motion, a second to adjourn.
I move to adjourn.
Tepe moves.
Second.
Shepro seconds. All those in